$380 billion is spent on diabetes care every year.
8 out of 10 diabetes patients do eventually succumb to diabetes-related illness down the line.
10 years on average, it can reduce your lifespan. Yeah.
Diabetes is arguably the worst health issue affecting the U.S. population, and for that matter, worldwide. In the U.S., for example, 1 of every 4 healthcare dollars is spent directly on diabetes management or complications of diabetes.
It's been estimated that if the current trends continue, 1 in 3 or 3 in 4 Americans would be affected by diabetes.
I think it's the pinnacle of achievement to be able to deliver a medicine that can treat tens of millions of people and really change their lives. I'm Thomas Butler, CEO and Chairman of Biomea Fusion. The company really started as a research project. It wasn't a company. It was just a few really researchers, entrepreneurs that really wanted to figure out how to develop and design a drug against a target called Menin. And we, as scientists, we do all these things because we care. We want to make a difference, and we want to use all our training and skill sets to help people. And that's really the driving force behind it.
It is fantastic to work in Biomere. It is a startup company. As such, we are focused on delivering the objectives. We have good science. We also have good people. And then on top of this, we have good leadership. All these combinations are wonderful factors to ensure that the company will be successful.
In type 2 diabetes, the beta cells play a very critical role. This pool of beta cells begins to deplete, leading to increasing levels of blood glucose. And this could be because the cells are dying, the cells are unable to regenerate or replicate, or all of the above.
At the time of diagnosis of a patient with type 2 diabetes, they've already lost over half of their insulin secretory capacity, or their ability of their beta cell to produce and secrete insulin. And over time, it's a progressive disease. So there's a decline in beta cell function. There's a deficiency in beta cell mass, so the amount of beta cells, the ability of the beta cells to produce and to secrete insulin, again leading to high glucose or hyperglycemia.
What we know about Menin is largely due to its role in oncology, but a somewhat lesser known role for Menin is its role in diabetes. And so what we do understand about Menin in diabetes is that Menin acts as a sort of brakes on beta cell proliferation.
This is a 3D print of Menin, and this allowed us to really have a deep understanding of how the scaffold protein works. And what I had an appreciation for were all the different nodules and hooking points that you see with this protein. And that explains why Menin has over 1,000 binding partners.
Menin is a protein that controls the number of beta cells. The beta cells produce insulin. The cause of diabetes is insufficient insulin. BMF-219 regulates the activity of Menin, and in so doing allows us to have a meaningful impact on diabetic patients.
We used BMF-219 to form a covalent bond inside. This renders the protein futile and is sent outside of the nucleus. And so that allows us to disrupt or to impact any protein-protein interaction that Menin wants to form with, because we take it out of the nucleus.
What excites us about the data are a few things. First and foremost, it's really targeting the underlying pathology of the disease. The second thing that we really like is that it can be given on top of standard of care very early on background medicine. And then thirdly, it's an oral therapy.
People are not on chronic therapy. They get an oral agent. Nothing needs to be injected. And once the pool has grown, you go your merry way until the pool depletes again.
The base case, we believe, for BMF-219 is that we make standard of care diabetic agents better because many of those agents need a functional beta cell pool to have their anti-diabetic activity.
Last year at ADA, we were able to highlight 2 key preclinical studies that we conducted with BMF-219. We showed that these animals could restore their glycemic control by inhibiting menin.
Now we have clinical experience. We've actually reported top-line clinical data, and importantly, the clinical experience thus far with BMF-219 in diabetes has completely paralleled what we would have predicted from the preclinical data we presented last year.
We have exactly seen the same pattern in the clinical setting. Almost 90% of patients had some kind of reduction in A1C, 78% had 0.5 or more reduction in A1C, and more than 50% of patients had 1% or more reduction in A1C. So this has been very remarkable data.
I have a patient that started the A1C, it was 8.0. This patient now, week 12, now is 6.9 A1C. So you can see it's an amazing decrease, and then it remains steady and remains stable in the number of A1C. And this medication does not cause any side effects, especially hypoglycemia or GI symptoms like diarrhea, like metformin. These patients, they are super happy. We do a physical exam when they come to the office, and they are doing amazing.
The strategy of Biomea is flawless. It's irrefutable, and the fact of the matter is, if it works, I mean, let's be honest, it's nothing short of brilliant.
What it means to me to be able to have this opportunity to target a patient population that's over 500 million worldwide is to be able to address the root cause. So what a wonderful opportunity that is for us to be able to deliver an agent for the first time in history that can increase your insulin production.